Welcome to Moments with Marianne. This is your host, Marianne Pastana, and we're here today with special guest, pharmacist Dr. Sue Ojageer, who's here to share with us why our allergy medicine isn't working and how to find the solution. So Dr. Sue treats people from around the world with groundbreaking genetic testing, PGX testing, to find the very best allergy medicine for each individual. This testing provides valuable information about how a person's genetics may impact their response to different allergy medications, enabling healthcare providers to make more informed decisions and determine the best course of treatment. So welcome to the show, Dr. Sue Ojageer.
Thank you. Thank you for having me on.
What an honor it is to have you here and to talk about this. I was so shocked to understand that allergy medicine, while it may work for some people and not others, there's a reason behind it.
Absolutely. That is a quite common concern that I get from many of my patients, and it's something that I love to discuss more with you.
So why is that? Why does it, work for some people and not others?
It comes down to the point that we're just very different. We're all individualized. So what may work for you may not work for me. So genetics plays a significant role in determining the response to allergy medicines, as well as other factors such as the previous usage of other medications. And, sometimes we start off taking one specific allergy medicine and it will do wonders for a number of years. And then we just find that it doesn't work anymore. So it's a way to signal us to either switch to something in a different class or another product that within the spectrum.
So how do we determine which medication we should be on and which one we should not bother taking?
Based off of our response and the coverage that it provides, if we're finding that we're still going through all the symptoms of sneezy, runny nose, itchy, watery eyes, and coughing, sneezing, all of those symptoms, and we're not getting any relief, then we can switch to something else, either in the same class or add something else based off of the symptoms that we're experiencing.
So is there genetic testing for that? And if so, what does that look like?
There are certain genetic testing, but for example, if you've been taking a particular medication such as Zyrtec and you're finding that it's not providing any relief, something else within that class, such as Allegra or loratadine or fexofenadine, may provide the same better antihistamine coverage. Or based on the symptoms, if you're experiencing a lot of congestion, maybe you need a decongestant or a nasal corticosteroid. And if you need further relief, allergy shots are also considered.
So there's several different options and different ways we can go. So if someone's looking to start with genetic testing and just kind of see, gosh, what works for me, what would be the best option, where do they start?
So genetic testing is a great way to introduce our clients to seeing what responses would work for them or what would be the best option, because we all break medicines down differently. What may work for you might not work for me, or vice versa. So depending on how we metabolize medications, there's certain predispositions that we have within our body that will give us a inside look to see how what class would work best, or what specific medications within these class will be the best option. And it's a very simple procedure where it's a swab testing that's done on the insides of the mouth, and it's sent off to the lab, and the results are sent to the provider. And all of the information is on there where we could review the results and give it to our patients.
Well, how exciting is that we get to be in an era where we can have these things checked out and decide what's right for us. I understand during the pandemic, you started Pharma. Can you tell us about that?
Yes, it started in the pandemic because I realized that I wanted to practice in the area of just providing the best care for my patients as a pharmacist and giving them a personal touch to their medications, because we all process things differently. We all produce different results. And I wanted to give that individualized care and attention to my patients so they could have the optimal results. And that's how Pharmacy was born. And it's growing now to to providing that white glove service that our patients need and deserve.
I know there's so much talk right now about using food as medicine. Is that something that you cover as well?
Yes, that is a very big part of the practice, and that falls into the category of nutrigenomics, where food is medicine. And you have to understand how the benefits of certain types of foods and your diet plays a big impact in our overall quality of life.
Well, we all care about that, especially now I think the allergy season's hit us, right?
Definitely, for sure. And there's certain foods as well too that could trigger certain reactions and immunoresponses. And inflammatory foods would exacerbate symptoms. So that's one thing to mention to our patients as well.
All very important things to consider. So, if someone wants to go ahead and get started and start working with you, where do they go?
They could contact me online. I'm on all social media channels at pharmasue.com, pharmasue.com.
Well, doctor, thank you so much for taking the time to be on the show with us here today.
Thank you so much for having me. It was a pleasure speaking with you.
Well, thank you, Dr. Sue. It has been such an honor to spend this time with you and to talk about what to do when our allergy medication just isn't working. Again, if you'd like to connect with Dr. Sue, you can at her website, pharmasue.com, for more information on how to be tested and to find the right medication for you. Well, we're at the end of our time today. I'd like to thank everyone for tuning in. You've been listening to Moments with Marianne, where we make every moment count.
In a single moment, your life can change. Moments with Marianne is a transformative hour that covers an endless array of topics with the best of the best. Her guests are leaders in their fields, ranging from inspirational authors, top industry leaders, and business and spiritual entrepreneurs. Each guest is gifted and a true visionary, a recognized leader in her own work, and while teaching others to develop, refocus, and grow, Marianne will bring the best guest and sometimes a special surprise. Don't miss this. You never know just which moment will change your life forever. Make sure to tune in and visit momentswithmarianne.com for more information.